Thank you for joining us to this session of our Get to Know series. So today's is Get to Know Goddard, which is the OU Health Services there on the Norman campus, and really just simply known as Goddard pretty easily. So we have Katie Qualls-Fay here with us today, health promotion, health educator there at Goddard, and she's going to give us the rundown, all the nitty-gritty important things we need to know about what's happening over there at Goddard with OU Health Services, how they help our overall well-being for students, faculty, staff, our OU community, what services and things that you can get engaged in. So thank you, Katie.
Awesome. Yeah, I'm super happy to be here. Thank you for having me. Like Lindsay said, my name is Katie. I am Health Education Coordinator with OU Health Services, and lots of information we're going to go over today. I'm super happy to share. I am curious if you all would put in the chat how long you've worked at the university. If there's anyone that's new to OU, I might want to follow up with you and just make sure you have all that you need. So in the chat, put how long you've been with OU. And I also want to put that or mention that we are on the Norman campus and we only service Norman campus students, faculty, and staff. And so if you are from the HSC campus or the Tulsa campus, thank you for being here. And I hope that at some point in time, you'll be able to refer somebody to us. But unfortunately, we are just a Norman only service. So Goddard Health Center is the building here on campus, but OU Health Services has been in existence in some capacity for over 100 years at OU. It's been in different buildings on campus, and I was able to look a couple years ago, well, 2019, I found out it had been 100 years since we were first named in Regents Minutes. And so I like to think that we came to be after the pandemic of 1918, and this was before the pandemic of 2020. So evidence that we did exist. Some people didn't know that we did anything before 2020, but just like to give that fun fact. So this is where we are. This is our building. The building has been here since the 60s, but health services has been here since the 19-teens. And our mission is to support the academic community by providing high quality healthcare and prevention education. And we do that in two ways. The high quality healthcare part is with our doctors, nurses, nurse practitioners, PAs, PT, pharmacy, lab, x-ray, dietitian, anything that would fall into the spectrum of primary care. And then prevention education is through health promotion department that I represent and work within the building to bridge the gap between everybody on the other side of Elm Avenue and in our building, and then also to keep students and staff in class. We couldn't exist and certainly wouldn't be successful if you all weren't feeling well physically, mentally, and emotionally. So that is what we do. And I'm going to go through our services broadly. So these are nationally the most common reported ailments that college students face. And this is primarily what we see and we treat and prevent and manage for young adults and certainly our faculty staff as well. Don't tell me what, but do the little raise your hand feature if you've had any of these in the last week. I don't know if anyone follows the Oklahoma Allergy Clinic, Asthma and Allergy Clinic on anything. They come up on the news every once in a while, but it's like very, 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 very high weed pollen alert, so allergies for all of us. Thanks for sharing. We see this all day long. And these are the things, certainly, something as normal, right, as PMS is going to keep somebody out of class sometimes. And so we're happy to see those patients. That is handled and taken care of in our primary care appointments with doctors, nurses, nurse practitioners, and physicians associates. Like I mentioned, they are assisted by certified medical assistants. And anything, again, like I said, that falls in primary care. The highest degree of specialty that we have is sports medicine, and that's for orthopedic injury and treatment prevention. We also can do like EKGs as part of a athletic physical, and then these services also can be preventive. And so if you haven't had a wellness exam in a while, we are happy to facilitate those. Within family medicine also falls reproductive health wellness exams, so a pap test. We're able to facilitate those, and I'll talk about sexual health here in a little while. Probably my favorite feature of our clinic is our pharmacy, because I personally benefit by buying my face wash and my moisturizer and my allergy medicine from right underneath my feet. We also sell at very great prices. We can fill, refill, and transfer prescriptions. So if you are in the Norman community and you're like, I can never get over, it's hard to get across town or whatever, or you're like, I'm on that side of campus all the time anyways, please go ahead, transfer your prescription to us. And certainly for students that you might work with or serve, if they don't have a vehicle, this is definitely the best option for them in getting the medicine that they might need, because the other pharmacies are on Main Street or on the east side of like East Lindsay across the train tracks. We also have a safety disposal box. So if you're like, oh my gosh, I think that Advil I've had in the pantry is like really old, or you took a trip and you threw a bunch of stuff in a Ziploc baggie and now it looks crushed and suspicious, bring it to us. Don't flush it. That contaminates the water, and we definitely don't need that. And so you can bring it to us and it is disposed of safely. One of our pharmacists is also a certified diabetes educator, and she really enjoys visiting with patients about managing their diabetes. Certainly with a collegiate lifestyle, that can be challenging, but then also just navigating what that means to live with diabetes. I said, buy your favorite skincare products. We sell sunscreen, we sell Band-Aids, we sell toilet paper, even toothbrush, toothpaste, tampons, you name it. And if you would like information about transferring your prescription, I'd be happy to provide that for you as well. Immunizations, I hope that you all have made a plan to get your flu shot if you haven't already gotten it, but you can schedule those with us online now. We had our clinics last week on campus, and now you can schedule them on Tuesdays, Wednesdays, or Thursdays with one of our nurses at your convenience. We also can continue allergy injection protocol if that is something that you receive. We wouldn't initiate allergy testing and allergy injections, but if you get those regularly and you would like to get them, or someone you know would like to get them here on campus, you can set up again an appointment with a nurse so that you can get that done at your convenience and not have to drive to Oklahoma Hazmat Allergy Clinic or wherever it is you go. We love having travel consultations too for people who are wanting to go to another country and might need to provide proof of another vaccine or do something preventative. Maybe you don't know the last time you got a tetanus shot. We're happy to get you up to date on that as well. At this point, we do not have the new COVID boosters, but we're expecting those in the coming days. We are waiting for our allotment from the health department in that regard. So this is not the comprehensive list of vaccines that we can offer, but this is the primary ones that people request. That can also be booked online, and I'll talk about that here at the end. We have an in-house lab and x-ray, and that might not mean a whole lot to you, or certainly it means nothing to our friends on this campus who are 18 years old. But what it means is that you get your results faster and you get them at a discounted rate, not discounted, but at a lower cost, because we're able to do it in-house and do it faster and not always send it off to a third party location. Sometimes we do have to do that. But for these listed here, we can do those in-house and get your results to you really quickly. You will need to see a provider before getting any of these tests. You can't just decide today's the day I'm going to get my liver tested or my thyroid tested. A doctor would need, or a provider would need to put in an order for that for you. But we do those often. We kind of the more popular one right now is this quad panel test, where it tests for flu types, RSV, and COVID all at one time. That's really popular, as you can imagine. And then x-ray also in-house is fantastic. We've been seeing a big increase in scooter accidents from people riding the VO scooters in places they shouldn't or in ways that they shouldn't. And so we've seen, people can come in for x-ray as well. Same thing, x-ray can be used for any kind of like lung x-ray as well if you're having some respiratory troubles. Sexual and reproductive health is something that can make people feel kind of squirmish, certainly students who are now on their own and trying to navigate this part of themselves. But I always, when I present this slide, I say, we saw that PMS was a leading reason that people don't go to class, and endometriosis or something like that is something that can be very debilitating and cause you to miss a lot of school or a lot of work. These are things that can be managed or discussed with some of our providers. And if necessary, we could refer to a gynecologist or an OB. We are happy to facilitate annual testing that people need for pap testing, breast exams. Don't offer mammograms. Lindsay can get you connected with the mobile mammograms I know are highly utilized and very convenient for our staff, but also treatment for infections that people might have, very common like yeast infection or BV. And we can provide, remove, insert all FDA approved forms of contraception and also provide HIV prevention medication as well. And we're happy to do that. Our staff knows that makes young people uncomfortable, and they're not new to talking to young people about these things. But even for people who are older and wanting to do family planning, they can visit with you about that. And then if you are pregnant, they would refer you to one of the great OB-GYNs here in the Norman area. Physical therapy is pretty straightforward. I think everybody knows what PT is. This is Danielle. She's our PT manager. We just hired another new PT to help with our patient load, and they help with the orthopedic injuries and pain management like you might expect. This is a really great service. A lot of faculty and staff really enjoy this service, having it on campus so that you're not driving across town. There's some fantastic PTs in Norman, but just being able to come over on your lunch break can really be something that's important just for your adherence to the protocol that you might need for your healing. We have a dietitian on staff, and this is a service that is used in a variety of ways. So often people just think of weight management, but she sees clients often for navigating family history or receiving a diagnosis of diabetes. Maybe someone is anemic or they have certain food allergies or intolerances that make it difficult to eat on campus or eat with a busy schedule. And she meets with them often about these things and can provide good resources. She's pretty neutral on most things. She's not the food police, as she says. She actually just provided an in-service to some of our providers this week about weight neutrality and how to be not stigmatizing when discussing weight with patients, or not discussing weight at all with patients in some cases. So she is brilliant and fantastic, and Cigna insurance covers at least one visit per year for employees. So that's a benefit that you can take advantage of. The University Counseling Center is also within Goddard Health Center, within our building. They are a different campus department, but they are in our same space. And so we collaborate and share resources with each other often. We quite literally share a microwave. So we're super, super close to them. They are a discounted rate for students because we know that they certainly need this support. I think being a young person today is really hard. And so we provide that discounted rate for students. For faculty staff, we will bill insurance, and you can schedule the same way that you would just by calling over the phone. They also offer couple counseling and group sessions for students. So that's something to look out for. They offer for like graduate students or grief, divorce, anxiety coping. And they also can do assessments when they have availability. So I'm not sure this semester what their availability is, because ADHD testing can take a long time. And at some point, when those appointments fill up, they would refer out to a provider in the community. An extension of the University Counseling Center is the Behavior Intervention Team. And hopefully you've been introduced a bit before, but they are a referral source for students, faculty, or staff that are in crises. They can connect someone to mental health support, physical health support, safety planning. I have used BIT when I was an undergraduate student. Someone I knew wasn't going to class, she wasn't eating, she wasn't talking to her family or her friends, coping with stress really, really poorly. And it was beyond my ability or any one of her friends' abilities to help her. And so that is something that I've used BIT for. So I just wanted to bring that. It's an online form, and you can submit that if you are concerned about someone's behavior. Health promotion, like I said, is the department that I represent. We do presentations like this all the time. Actually, at this exact moment, my students are giving this exact presentation to a freshman course in our building. And we do campus programming and promotion. I went last night and spoke with some of the RAs in Cross. Monday night, I went to a scholars group, went to a housing event this upcoming week. We're going to, I can't remember. We have so many events and presentations. We're doing a Safe OU Texas event next Wednesday. That's what it is, on the South Oval. We offer free menstrual products at events. You can see our student right here. She's holding up some free samples that we have from our dietitian, some plant-based protein options for people that are vegetarian or vegan and want to get some plant-based protein. We partner with student groups and departments. We also have an in-body machine. You can make an appointment with us if you would like to do an in-body assessment. And then here is just kind of our menu of presentations that we offer. We also do the mandatory alcohol education that students have to receive once they come to the university, and and special programming by request. If you're not following us on social media, I hope that you do. We have Facebook also, but usually I give this presentation to students and they don't have Facebook. So we do have Facebook, very easy to find. We're OU Health Services there as well. Okay, so our most common questions, this is probably the most boring slide, but the slide with the most FAQs is medical records and insurance. So I'm assuming that everyone here is on OU Cigna insurance or on the student health plan. Maybe you have a different kind of private insurance. We have a page on our website that discusses kind of common questions we have about like TRICARE or Blue Cross Blue Shield. We will file to any insurance that you have. We've even filed to international agencies. What they do and don't cover is up to the insurance provider, but we will advocate for you to get things covered. Certainly with Cigna, your preventive services are covered, that kind of thing. With students, they worry about who's going to see what they were seen for, often the EOB. That can be, you can sign a release of medical records. Certainly, as an adult, you might want your partner or family members or your providers, your specialists to see your medical records with us. And so you would physically sign that release of medical records by asking our patient services staff, but it's not expected. We're only going to release it though if you have given us written consent. And we will keep your medical records for 10 years. So if you don't know the last time you had a tetanus shot, but you've been here for a while, ask us, we'll find out for you. Like I said, you can visit our website with some common insurance questions. And for any students or students that you support who are uninsured, there is a pretty low rate of uninsured students on our campus and nationwide, but maybe their plan isn't working well for them. They're out of state and they're paying a lot out of pocket. I highly recommend the student health plan. Open enrollment for that will be the first 2 weeks of classes when they come back in the spring. The open enrollment period has closed for this semester. And within all of that is also, how do you access your provider? Where is your medical record kept? We have an online patient portal that is separate from all your other OU accounts. It has an OU URL, but it is not an OU web address per se. And that is Health Connection. If you've been a patient of our clinic before, you have probably received your medical, your lab results, your COVID test results, your refill, summary of your appointment, that kind of thing through Health Connection, but you can message with your provider there. I was going to talk a little bit more about it and just kind of explain some of the other things we offer to enhance the patient experience. We have a language translation line where we can translate over 200 languages by phone, and we also have video conferencing if someone needs American Sign Language. We have accessible bathrooms and entrances, as well as gender neutral bathrooms all throughout the clinic so that patients feel comfortable and safe. Like I said, we now have online appointment scheduling, and that has been wildly popular. We have where you can select about 25 of our most common appointment types, and then you can even select a provider and then select based on your schedule what works for you. And like I said, also with flu shots, you can do that online also. We have text reminders for refill pickups and an app where you can request refills for your prescriptions. We also added this summer cost transparency. So we don't have every single procedure and every single service that we offer on our website, but we have about 100 of our most common ones. And what you'll see, those are student prices, but kind of get an idea of how much things would cost. If a student were to ask you, how much does it cost for me to get a strep test? They could go and they could get a good estimate of what that would be. I've mentioned the patient portal. We also coordinate lactation rooms for the Norman campus. So if that's something that you or a colleague might need, a student might need, we're happy to set that up. It's seamless. We just connect it to their OUID and they tap into these really beautiful spaces on campus. We also have a free patient education library on our website for common conditions that people experience, like stomach illness or migraines or depression or eating healthy food on the go. And there's on our website, you can access that through the health promotion page. And they're up to date, they're updated by the American College Health Association. It could also be a good resource for a student if they're telling you that they've had mono or strep, or they just have a chronic sore throat. Of course, I hope you refer them to us, but you could also share one of our like library kind of flyers with them. Oh, I'm just not seeing the comments. Love that protein shake. It's literally, I have it every single morning. And other question for PT. An outside doctor can refer to Goddard. Yes, it does not have to be an in-house referral. Great question. And then I'm seeing a Q&A. We do not have the new COVID vaccine at Goddard yet. We will blast it once we have it, but we just have not received our allotment yet. So here is our contact information. Take a picture of it, take a screenshot of it. I hope that everyone saves it in their phone. And I tell everybody that gets this presentation, I tell them, you may never need it. I hope need us. I hope you never do, except I do hope you do preventive your wellness appointments every year and get your shots. But you may never need to use our phone number or our website. Someone you know, you work with, you serve, they will need it. And so I hope that you save it. Down here, I have just the general clinic questions you might have. Appointments is the 4441 number. General clinic appointments is the 4611. If you want to speak with a pharmacist directly, it's that 5165. And then the counseling center right there is 2911. When you come to your appointment, bring a photo ID. It's preferable to have like a state or federally issued. That's just best practice. But if you've been a patient before and we have an image of you, they're not going to turn you away. They will like to see it though. And health insurance card, even a photo is fine. If you have OU Cigna, sometimes we can look it up. But we tell students bring what you have. And then for payment, somehow, for some reason, I haven't been a student for a very long time, but some reason it still goes to my bursar account. I end up just walking downstairs and paying downstairs when I have a copay. But we take all regular forms of payment that you would expect. We're open Monday through Friday, 8 to 5, because we are primary care. So on our website, we have information about after hours services. We, a lot of times parents or people that are new to the university, well, what about this situation? Or what about this kind of dramatic situation? And I said, we're happy to call 911 for you. But if you're having chest pain or a bone is sticking out of your body, you need to call 911. And unfortunately, we just don't have the staff or the demand actually to be open 24/7. So we're primary care, like a regular doctor's office, Monday through Friday, 8 to 5. And here is where we're located, kind of a more artistic representation of us, but we're across the street from the library and a physical science center. We have patient parking, so you don't have to worry about that. You do have to pay like 50 cents or something. But I tell people, if you're parking in our parking lot and going to class, know that you're taking the spot from someone who's sick and hurt. And so you should feel bad about that if you park in our patient lot and you're not a patient. Oh, hi, Lisa. I see. If you're in the clinic and they think it's necessary to call 911, yeah, they absolutely will. Cool. So that is the content I have. I have a quick survey. I'm just curious if you have a question that you wasn't answered or you'd like to follow up, you can please click that link. But I would like to know what you thought of this. We'd like to offer it several times throughout the year, certainly with different cohorts of new employees. It can be helpful. But I will quit talking and I will answer any question that you might have.
Certainly, just to echo someone else said, a lot of great information, great services. I hope that you all at least learned one new thing today, even whether you've worked here for a month or 20 plus years, because we kind of, as we saw earlier, kind of have the range of it. So that is great. And also that the fact that these services, a lot of these departments have updates all the time, kind of like the online scheduling is a fairly new thing, new tool to be used there at health services. So that's definitely awesome. And certainly helpful to offer all these services on campus to kind of get back to work or class or life as quickly as possible. So that is certainly helpful, and staying on top of your regular preventative stuff, vaccinations, all of that. Great, great stuff. Katie, I know you did mention early on that really for Goddard OU Health Services there on the Norman campus, how it's set up, that it really is for seeing the Norman faculty, staff, and students. As far as it goes with Kelly for nutrition services, dietitian services, and meetings, I know she has virtual opportunities that she can set up. Would an employee from either our Tulsa or Oklahoma City campuses be able to set up an appointment with her, even, with it ran through Cigna insurance or various other insurance? Do you know? Putting you on the spot.
I think so. I'm actually our business manager is on the Zoom. I don't know if Brenda, if you're able to answer that question. I could find out though. I don't know why, if it's all like the same, if it's all the same insurance plan, I don't know why they wouldn't be able to. Thanks, Nova. I can find out though, if that's a question that you've gotten.
Excellent. Sounds good. Yes.
Sorry, yeah. I don't know why. I can't think logically why it wouldn't work that way. But yeah, certainly by telehealth, I think so.
Awesome. Yeah, and I know it's kind of an interesting thing that sometimes we have HSC employees that are located on the Norman campus or right around the Norman campus, and vice versa. We have Norman-based employees that are actually housed or located on or around the Oklahoma City campus, or and then Tulsa's kind of a mixed bag. So
I'm actually, if people want to wait, I'm texting our dietitian texting me, so I'm gonna ask her right now.
What's great with these tech virtual environments,
I know, we'll just get
information simultaneously on the spot.
Immediacy, that's right. Any other questions I could answer, or if there's something that you don't want to ask out loud, I get that too. You have, you just don't want to discuss it with other people. I've dropped my email in the chat, and I will stay on, but I really would love your feedback through that quick survey, and you all get wellness points for being here too.
Yeah, absolutely. Thank you so much, Katie. I'll make sure in that follow-up email again to include contact information for Katie if you have questions that you kind of want to check in offline. Also, the website for Goddard to, again, keep up with their information. There's a newsletter that they send out, so make sure you opt in for that, subscribe for their newsletter so you can keep getting those up-to-date events and information that they shoot out there.
Yes, for sure.
Awesome. Well, thank you all so much. If you need to head out, we really appreciate you being here. Katie, thank you, and have a wonderful day.